CNN's Kristie Lu Stout, live for us this hour in Hong Kong. So, Kristie, there's growing concern about the real toll of China's current wave of infections. How do we know these numbers are real, and what more do we know about this?
Yeah, I mean, concern is certainly rising over the true scale of COVID-19 infection across China. Look, official figures in China are not reliable, especially now as the country carries out less testing as it unwinds from years of its zero COVID policy, and especially after it recently narrowed its definition of what constitutes a COVID-related death. For this month, for December, so far, China has officially reported only 8 deaths from COVID-19. 8. That is a remarkably low number, especially in the face of just mounting evidence showing a surge of infection and COVID-19 deaths across the country. In the Chinese capital in Beijing, our team on the ground there has filmed evidence of a completely packed and overwhelmed crematorium. The parking lot there is packed. Smoke is seen billowing constantly from its furnaces. There are yellow body bags piling up on top of each other. Hospitals in Beijing are overwhelmed. There are reports that medics from other provinces are being sent into the Chinese capital to help pitch in and to assist. Meds like fever and cold medicines are running out. People are scared. People are desperate. We do have this statement we want to share with you from a resident in Beijing. Her name is Fairy Zhang, and she tells CNN this, quote, "In the past 5 days, I had many symptoms, but couldn't buy any medication to treat sore throat, coughing, or fever. None of the medicines are available," unquote. The U.S. Secretary of State Antony Blinken is now calling on China as well as other nations to share, to be transparent about their COVID-19 outbreaks. He cited a number of concerns, public health concerns, obviously, economic concerns, but also concerns about a possible new variant emerging. This is what America's top diplomat said. He said this, quote, "Anytime the virus is spreading or is moving around, there is the possibility that a new variant develops. That variant spreads even further, and it comes and hits us or other countries around the world," unquote. We've learned in the last few hours that Secretary Blinken spoke with China's Foreign Minister Wang Yi on the phone to discuss several issues, including the COVID-19 outbreak in China. And according to the White House readout, Blinken emphasized the importance of transparency for the international community. John.
Kristie, thank you. Just very quickly, earlier today there was a story from CNN's Selena Wang about packed crematoriums in Beijing. In the past, something like that would have been censored by the authorities there, but this one wasn't. So what's happening?
Yeah, when that story went to air, Selena sent us all a note and said, wow, that was surprising. They usually censor such sensitive material. State media in China, they usually avoid or stay away from sensitive videos of packed hospitals or packed crematoriums. But this story actually went to air. And this underscores the chaos and confusion inside the censorship regime in China. Ever since China began this U-turn, ending and unwinding years of the zero COVID policy, there hasn't been a clear directive given to its propagandists to tell them what is the best way to frame the situation in China right now. That's what we're seeing playing out in state media as images that were deemed to be too sensitive in the past actually make it to air and not get blacked out. John.
Wow. Kristie, thank you. Appreciate that. Thank you very much. Kristie Lu Stout, live for us there in Hong Kong.